ECG made simple in just 5 steps. Going directly into the topic, step 1 is the calculation of the rate. Here, what do? We have a strategy, and the strategy is 300, 150, 100, 75, and 60. And this is all the number that you have to remember. Now, what are we going to do with this number? We're just going to an ECG. When you get an ECG paper, we are going to look at the RR interval. So, this is an R, this is an R. Now, we're looking at the RR interval. The RR interval among every boxes and counting how many large boxes are between this RR interval. We know that this is a large box and this is a small box. Now, between two RR intervals, we have 1, 2, 3 large boxes, which means one large box is 300, two large box is 150, three large box is 100. Now, what is the rate of this graph? It is 100 beats per minute. As simple as that. But this is for a regular RR interval. When it's one large box, it's 300. When it's two, it's 150, 3, 4, 5, 60, and so on. Now, when the RR interval becomes irregular, what you have to do is you have to count 30 large squares. Because you have to remember that one small square is equal to 0.04 seconds, which means when you take 15 large squares, it becomes 3 seconds, and 30 large square becomes 6 seconds. Our task is to count 30 large square, which equals to 6 seconds, and multiply it by 10. So what do we have to do? Here I have an irregular graph for you all. I've already counted the numbers. So you have 1, 2, 3, 4, 5, 6, 7, 8, 9, 11, 12, 15. And another 15, which put together is 30. Now your job is to calculate how many R peaks are between them. So starting from here, we have 1, 2, 3, 4, 5, 6, 7. So you have 7 R. What do you have to do now? Multiply it with 10. Boom. You've got your rate. It is 70 beats per minute. That's all. So this is for your regular and this is for your irregular. Moving on, step 2 is rhythm. Is basically looking at the RR interval and looking if P wave is married to the QRS complex. If the P wave is before the QRS complex, it's a sinus rhythm with RR interval regular. If the P wave is absent and RR interval is irregular, it's a classic atrial fibrillation. You don't have to memorize, you just have to understand the logic that when the impulse travels from SA node to AV node, as you know, both of them are present in the atria of the heart, it's a P wave. That's basically the depolarization. But when it travels from the AV to the bundle branches, that is to the ventricles, it is the QRS complex. So in atrial fibrillation, the atria contraction is a very rapid and impulsive, not synchronizing with the ventricular depolarization. Hence, the signals are too fast to be recorded or sometimes irregular or absent, leading to a missing P wave before a QRS complex. And hence, it is a classic sign of atrial fibrillation. So here I have a picture where if you see the intervals are irregular, that is, this is an R, this is an R. So there's only like 2.5 boxes. This is an R. 1, 2, 3, 3.5. This is just having 2. This is just having 2.5. This is having 3. This is having 3. This is having 2. So this is an irregularly irregular. So you have something called regularly irregular. But what we have here is an irregularly irregular. And why do we say it's an atrial fibrillation? Because you have no P wave. There's no P wave. No P wave following a QRS complex. So, P wave is absent. Something is happening to the atria, which means the SAAV node problem is going on. So, your P wave is absent and hence it is a atrial fibrillation. Now, to interpret this and review the step 1, where in step 1 we have to calculate the rate. So here it is irregular. So what you have to do, you have to count the large 30 boxes. Now suppose we are starting from here. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. This is the last one. So you have around 1, 2, 3, 4, 5, 6, 7, 8, 9. You have 9 peaks. So 9 into 10 is equal to 90. So basically it's 90 beats per minute. And it's irregular, no P wave, atrial fibrillation. Now look at this. Here you have a P wave, and then you have a QRS, you have a T wave. You have a P, you have a narrow QRS, and you have a T. So basically, what is this? It is a regular sinus rhythm. So it's a normal sinus rhythm with all of that. So it's a normal rhythm, which is regular. So how do you calculate the rate of it? It is simply by calculating the boxes between them. So 1, 2, 3, 4, half and half. So here's a half, here's a half. So we can have it as 5. So it's basically 300, 150, 100, and then you have 75 and then 60. So this is the fifth number. So it's 60 beats per minute. So here comes your answer, which is around 75 to 50, because you have half of boxes. When you can equate to 1, it's an approx value. So normal heart rate, regular, P wave is present. So it's a classical sinus rhythm graph. Moving on. Step 3, axis. People consider axis to be very complex, but it's as simple as this. All you have to see is only lead 1 and AVF. So you have to know lead 1 is 0 degrees and lead AVF is 90 degrees. And between them, you have lead 2, lead 3, 180, and this is 180, and this is negative. So normally when you have studied graphs in school, you've studied that these are positives and these are negatives. But here, there's a interchange between these both. So here what you have is positive and here what you have is negative. Now look at the QRS wave. That is what you have to find. If the height of the R and the height of the S are equal, it's isoelectric. But if the height of the R is greater than the height of the S, it is positive. If the height of the R is less than S, it is negative. Now this is what you have to remember. Now coming here, you have to find the axis of this ECG that has been given to you. You have to look at lead 1 first. You have to remember this is how a lead will be arranged. You have lead 1, lead 2, lead 3. AVR, AVL, AVF. And when it continues, you will have V1, V2, V3. You will have V4, V5, V6. So our concentration is AVF and lead 1. So here you can see the QRS complex. The QRS complex shows you that the R is greater than S here. Yes, which means it is positive. Coming to here. Here also you have the R wave greater than S, which is again positive. So it's positive, positive. We know that this is lead 1 and this is AVF, 0 190 degree, both of them positive, lying here, and it's normal. Moving on. Looking at the second graph, again, you have to look at lead 1 and you have to look at AVF. Here, the R is more than S, which means it is positive. Here, you have something like this, where R is less than S, so it is negative. Now, where do you plot this? You have the lead 1, you have AVF. But lead 1 is here. AVF is not on the positive side, it's on the negative side. So your graph is plotted here, which is a left axis deviation. Moving on. Again, 1, you have a long S, so negative. And here you have a long R, which is positive. So lead 1 is negative, which means it has to come this side. Lead AVF is positive. It can be on this side. So it is here. So this is a classic right axis deviation. As you can see here, this is a right axis deviation, wherein lead 1 is negative and AVF is positive. Coming to the last one. Here you can see that it's negative. So you cannot see R wave. So you have a large S wave, and here also you have a large S wave. So both are negative. So lead 1 is also negative. AVF is also negative. So your point lies in here, which is an extreme axis deviation. So this is a 20-second diagnosis. If you want, you can go back again, listen it again, and then you can make sure that you can make the diagnosis in just 20 seconds by looking at the axis. Moving on to step 4, we look at the intervals. What are the intervals we're worried about? PR, QRS, QT. Moving on to the first one, prolonged PR interval. So it is due to impulse conduction disturbance from SA to AV node, because I've told you before that from the SA node to AV node, when there's a block, it's P, and from AV node to the bundle branch, when it goes, it is QRS. So we have a P problem. So it is basically somewhere between SA and AV node. Therefore, it's as simple as that. It's an AV block or first degree heart block. Here you can see a prolonged PR interval. Normally, a PR interval has to be only 4 small square width. It should not be more than a small square width. But here, if you see, it's around 1, 2, 3, 4, 5, 6, 7. It's a lot. It's 8. So hence we consider this as prolonged PR interval. But if you look, the RR waves, the distance between the RR waves, they are equidistant. So it is regular. So how do you calculate the rate of a regular RR interval? Basically counting the boxes between them. So you have 5 boxes, which is 300, 150, hundreds, and finally 60. So 60 beats per minute. So this is a regular 60 beats per minute, which is normal, because the normal heart rate is 60 to 100 beats per minute, and a prolonged PR interval, and hence it is an AV block. It's classical AV block. Moving on to QRS complex. QRS means we come down from AV to bundle branch. Therefore, the bundle branch block in the QRS prolongation is because the impulse conduction from the right to the left bundle branch or from the left to the right bundle branch is not synchronized. It is leading to the irregularity. So normally the QRS complex is very narrow. So it basically it has to be very narrow, that it is only one small square box width. But here it is too wide. If you see, it's nearly more than 1, 2, 3, 4. It's like approximately 3.5. It's 3.5 boxes. Hence, it is a wide QRS complex. Additionally, I just want to tell you that when there's a W shape, so here you can see the W shape. There's a W shaped graph, and here you can see a M shaped graph. So when there's a W shaped graph, is due to the right to left or the left to right unsynchronized impulse transmission. Now this is V1, this is V6. Don't forget to see what lead are you looking into. So in V1, if you see a W shape, it is left bundle branch. In V1, you see a M shape, it is right bundle branch block. So here in V1, we see a W, which means this is a left bundle branch block. So basically you say it as left bundle branch block, LBB. But if I get the V1 to be something like this, which is like this, then it is a M. So when it is M, it is RBBB, which is right bundle branch block. Moving on, QT prolongation. So at MBBS level, QT prolongation, just remember 2 important causes, which is electrolyte imbalance and drug effects. That's all. Moving on, step 5 is about deducting the deadly patterns. You just have 3 deadly patterns, and by remembering this, you can save yourself in the wards in ER. First one is STEMI, ST elevation myocardial infarction. So this is the normal electrocardiogram, wherein this is a STEMI, where you have a P, you don't have a Q, you have a R, and then if you see the S and T are elevated. So this is a classical STEMI ST elevation. Next, atrial fibrillation. I've told you before, if you remember, in atrial fibrillation, from AV node, from SA node to AV node, there's impulse transmission disturbance. So what happens? P wave is absent because this corresponds to the P wave, and it has to be irregular. So if you see, it's irregular. The RR intervals are very irregular, and the P wave is absent. There is no P wave before a QRS complex. So this is a classical atrial fibrillation. Moving on, ventricular tachycardia. So when you look at ventricular tachycardia, here what the ventricular tachycardia I have given you is regular, and you can see between two RR complex, that is between one R and another R, you can just see one box. So just one box means it is 300. So the rate is 300 beats per minute because of one box, but it's a regular 300 beats per minute. The normal heart rate is 60 to 100, wherein 300 is very, very tachyc. It's tachycardic. And QT prolongation, classical, fast and wide, which is very dangerous, leading to ventricular tachycardia. Now putting all the steps together and solve your next ECG in just seconds. Now I've given you these questions to get your diagnosis. Now verify each one of them. Plot your answers beside which with the steps I've given you so that you get the rate, rhythm, axis, QRS, ST prolongation, ST elevation, QT prolongation, if the P wave is present or absent, and you get your diagnosis. Comment below in the comment box. Comment in the comment box so that we can just check and review the answers. So if you all want, I am giving you the PDF of this sheet in the description so that when you click on to the link in the description, you can get the PDF that I have shown in this presentation. All the best. So if any doubts, ping me, or any more videos do you want, you can put the heading of the videos in the comment section, which will be made within 24 hours and delivered to you. That's all. Thank you. Have a nice day. This is Amu from Med School signing off from you. Tada.